How difficult do you find it to encourage Black men to participate in clinical trials to try to find out more about why colon cancer and prostate cancer affects them disproportionately than their white counterparts?
It's not difficult at all.
Really?
Nope.
They serve themselves right up on a platter.
And that's the problem.
Okay.
So a lot of the
it's just the fact that they're not asked,
yes,
correct?
That's the problem. Like,
okay.
They're not asked, and even when they're asked, they're not presented all the information. Okay. So when you, whether you're in a rush as a doctor, got a couple of minutes with the patient, or you decide subconsciously without knowing it that this person will not be able to do this trial because it requires them to come into the city, blah, 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 you may choose not to offer them, or you may just gloss over it. If you present me with something that I don't know the details of, I'm likely to say no. But studies have shown, and I experienced it too, if you do present anyone, whether it's Black men, women, other underrepresented groups, you present them with clinical trials and give the information, even when they're not English speaking, different languages, they take it in, they ask very insightful questions, and they're willing to participate in the trials. Mm-hmm. Obviously, sometimes some people would come in with the impression that I don't want to be a guinea pig. Mm-hmm. And that's legit, but you have to explain it to them. And it's not that hard to get them involved in the clinical trials or interested.
Okay, well, I want to move back to, screenings and early detection. I am on a podcast with a lot of men. I'm the only woman, as a matter of fact. And I try to lead by example. I post all my gym videos. I come in there with my salads, and I'm not gonna rat them out and talk about what they eat and what they don't do in the gym. But they're my friends. And so I, kind of share my concerns with them. As we get older, we start to live more sedentary lives. Our lives get busier. Mm-hmm. We're getting older. So it's a little bit, you just get tired a lot of the time. You're like, I'll go to the gym tomorrow. And then tomorrow becomes next week, becomes next month, becomes next year. And that gym membership goes to waste. But I'm seeing the men that I'm around kind of exhibiting habits that their younger selves can get away with, but their over 40 selves, I start shaking my finger. You got to watch out, because plaque will start creeping up into your little coronary valves, and also your cholesterol will shoot up, and so will your blood pressure, and all of these, they're called comorbidities, correct?
Correct.
Exactly.
And risk factors.
And so I find that the one thing that they really are the most frightened of is getting the finger up their bum. I'm sorry. For me, listen, as women, we go through so much. We get our boobs smashed in between two plexiglass plates. We get medieval devices shoved up inside of us. We go through so much. So that is the one thing that we get to, enjoy mentally, that picture of our men in their most vulnerable state. I'm sorry, I'm being honest, okay? But tell us, what are the most effective methods for screening and early detection? How often should men be doing this, and when should they start? And not necessarily just men, women too, because, prostate, we don't have prostates, right?
No,
women?
Not
Okay,
last
just checking. Okay. But we definitely have colons, and my mom passed away from colon cancer, so I know that I'm of an increased risk. So I had my first colonoscopy at 43, and I am due for my next one. Wait, 43? No, sorry. It's 46. Yeah. And I'm due for my next one next year. So I have to go every 3 years. So what are the most effective screening methods for early detection? How often should men be getting this, or people should be getting this, and when should they start?
Yeah. So colon cancer, really talking about colon cancer here, it's probably one of the only cancers where we know what it looks like before it becomes a cancer. So we can really go in there, see a little polyp and say, you're going to become a cancer in 10 years. Let's just take you out. And that way we've cured the cancer before it even started.
That's my story, is I had my colonoscopy. So I drank the liquid. I drank the whole concoction that you have to drink over the course of 24 hours. You can't eat any food, and you're drinking light Gatorade and Miralax. just
Yeah.
bottles
That's
of
one,
that,
yeah,
okay?
yeah.
And you're just like flushing the whole situation all day long. Just don't go anywhere. Don't even walk your dog. Don't go anywhere for those 24 hours because anything can happen. And so the next day, I got to the, I got to the facility, to the medical facility, and they got me my gown and everything like that. And they told me after, they were like, wow, you did really good with the, with your prep. You were clean as a whistle. I, for some reason, felt like I'd achieved something. But they said, we found one polyp. And if you had not come in and gotten the colonoscopy inside of a year, it would have been cancerous. So I know exactly what you're talking about when it comes to seeing it and identifying. So go on.
Yeah. So I mean that's the idea of the screening. Like we find it, you don't have any symptoms, it's not a problem, we take it out before it becomes a problem. And nothing beats that. A lot of the advances we've made in terms of survival and improving survival with cancer most of it has come from preventing or catching it early. While we have all the fancy new medicines that treat it, nothing beats catching it early. So with screening for colon cancer, the colonoscopy is our gold standard. And it's more than a finger in the butt. It's a whole camera tube that goes in there, but it's a thin camera tube. The part of that that's the most challenging, which you described and you aced, was the cleaning out, because you're just cleaning out yourself the whole day. It feels crappy. But the advantage of the colonoscopy is you go in there, if whatever you find that looks abnormal or that looks like a benign polyp, a gentle polyp that will later become cancerous, you take it out. That's been for a while the primary aim, the primary recommendation. But in recent years, we realize that a colonoscopy is not the easiest procedure to prep for, but also it requires you to take a day off work, requires someone to go there with you, and not everyone has the ability or the luxury to do that. And now we have stool-based screening tests for colon cancer.
Like Cologuard.
Exactly.
So I was going to ask about that because I see the commercials on TV all the time, and I wondered if that is an effective screening method for everybody, or if there's some people that get excluded from it being effective for them.
It's not effective for everyone as the way a colonoscopy is. It's not, the colonoscopy is still the gold standard. The advantage the stool-based testing has is people are more likely to do it. Once a year, stool testing, and that's it. But if it is positive, you still have to do a colonoscopy. For the Cologuard, for the stool-based testing, it's typically for the average risk person. And we can talk about what average risk or high risk is later on. The colonoscopy for all kinds of risk. We just adjust how frequently we do the colonoscopy testing.
But please expound on who is the most at risk.
So average risk, essentially, when we think of risk, we think of risk factors. And when you were talking about your friends, your co-podcasters, and as we get older, that's one of our risk factors, age. The older you are, the more likely, the higher the risk of getting colon cancer. And it's what we call a non-modifiable risk factors. Nothing I can do is going to make me younger today than I was yesterday. But the other things we do, watching our diet, being more active, doing our screening, those are the ways we can mitigate that higher risk of getting older. So for the average risk person, essentially you have no high risk features, which is a family history of colon cancer. You don't have that. You don't have any diseases like IBS that increases the risk of colon cancer, or there's no genetic predisposition that increases your risk of colon cancer. So when you don't have any of those, you're considered average risk, and you start screening for colon cancer at the age of 45. Used to be 50, and it's been several years that it's been brought down to 45, but even in my interaction with black men in New York and other people, many people still don't know that it's 45 yet. But 45 is the age.
Okay,
average risk.
so Chadwick Boseman died at the age of 43. He was younger than the prescribed age for screenings to start. I don't know anything about his journey through, dealing with colon cancer, what his doctors told him, how he discovered that he had it, why it was terminal, et cetera, et cetera. But what happens for people that are younger than the screening age? Like I wonder to myself, how could an early screening for somebody like him have prevented the outcome? Because the mandate is for 45 years old. So what happens in that kind of circumstance? And also, I guess a better question would be, what might somebody be feeling by way of symptoms, that might alert them to something is not right when it comes to their colon and their rectum?
Yeah. So, for the first question, it is without knowing details of Chadwick's history or family history and not being able to tell what risk factor is. I've had unfortunately a few patients that know average risk and were diagnosed with cancer earlier than the recommended screening age. The recommended age is, the truth is, with most things, it's designed to capture most, and they try to find a balance where you're not over screening because it causes harm, but you're also not losing out on skipping too many people. But it just doesn't capture everyone. Now, the part where the next question you ask about the signs, it's very important. When we talk of screening, it's when you don't have any signs, just what we should be doing. But when you have signs, and this will tie back to what Chris was talking about, what he has mentioned several times, it's really your body. When something is off with your body, you know it better than anyone else. You can go see this doctor and they would say, oh, it's nothing, but you just feel like it's not just gas. It's more than gas. So you have to persist in that. But symptoms include blood in your stool. It's abnormal. Yes, you may have hemorrhoids, but let someone look and see, is it truly hemorrhoids or is there something more to that? Change in your bowel habits. So if you're usually regular when you go to the bathroom for number 2 and you're having your bowel movements on a daily basis, but you notice, all right, I'm starting to have constipation, which is odd.
Frequent constipation.
Yeah, okay. Frequent constipation, which is unusual for you. Or diarrhea, any change in bowel habits. Abdominal pain, obviously anything should be investigated. And if you notice more advanced symptoms, like if you're getting easily tired, that could be an indication of more advanced cancer, but it could even be an indication of an earlier cancer, but you're just slowly bleeding without knowing it. So your blood levels are decreased. But any of these signs that you have, go find a doctor, make sure that it's evaluated. If you don't like the response you're getting from one person, keep going till you find someone who will do the proper investigation for you.
So I want to go back to the stigmas, the cultural and societal stigmas around health concerns when it comes to Black men specifically, especially involving, intimate areas of the body. What would you say is the rate in which you find patients at late stage colorectal cancer?
So I'm a little biased in what I see,
Okay.
being that I work at a cancer center. So by the time I see patients, it's already been diagnosed, and typically also the more advanced ones. But for colon cancer, we do have a good, I'd say majority of patients are diagnosed at an earlier stage. I do see more advanced cancers than the average.
Do you talk to them?
About the...
Like, do you just sit down and get the story behind why they avoided coming in, what the avoidance was based on? Do they ever say it just was not the manly thing to do? I just did not want anybody poking around back there. Like, do they actually say this to you?
No, I do talk to them. And a lot of it is more not fully understanding or appreciating what should have been done.
In what way?
So not even knowing that they had to do the point or the value of doing these screenings. So it's like, oh, yeah, I've heard about that, but, I just figured it's something that we do, but not really understanding that it's the difference between finding a cancer at a point where we can cure it with minimal treatments, or using more aggressive treatments and still not be able to cure it. I think the information out there is just not sufficient enough. There are instances where they know, but they just didn't have the time. It's because of work or because of family or things they had to do, and they kept pushing it back. But in more cases than not, it's just not there. Just the awareness is not there, not fully there.